folks. Thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing the marketing and selling of Medicare Advantage plans, and doing so in a compliant yet profitable process, and considering that we're looking to do this all year long. We've just come out of a very hectic time of the annual election period, and while that concentrated series of weeks produces a large number of applications, the majority of Medicare Advantage apps are produced in the remainder of the year. And so knowing what we can and cannot do when it comes to the different election periods and the special election periods that we are faced with because of different regulations created through MIPA and some of the other legislation, it's nice to be able to look back a little bit and learn from the lessons of our marketing during the annual election period and how we can maintain that momentum and continue on selling throughout the year. So today's topic centers on that very discussion. Today's presentation is being recorded, and it, along with many of the articles and other data that we present to you today, will be sent to all by email after the presentation is completed. And that will go out to everyone who has RSVP'd to today's presentation. A bit of housekeeping: if you'll notice, the software package, the GoToWebinar software package, has a section in there for questions. I'd ask that you place your questions in there. We will make certain that we address them all. Many of them tend to be addressed through the course of the presentation, but we want to make certain that we get you the answers that you need or are looking for. We'll start with a little bit of a level set about who we are at Premier Marketing. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, providing insurance services to the public through independent insurance agents such as yourself. And contracts are available at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, being founded in 1968, that means we recently celebrated a milestone in our history, our 50th anniversary, and we consider that a major accomplishment for what started as a small family agency in rural Nebraska that's grown into one of the largest marketing organizations of its type in the country, especially in the Medicare space. We do so through a full portfolio of products that include the basics for Medicare programs, the Medicare Advantage and Med Sup plans, and the standalone Part D prescription drug programs, the PDP plans. But we also offer a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans, long and short-term care programs, disability income plans, and the ancillary benefits that fill the holes in a non-supplemental situation in many circumstances. Those ancillary benefits that include dental, vision, hearing products, critical illness and cancer plans, and hospital indemnity programs. That Medicare Advantage portfolio includes the national carriers and many of the strong regional carriers that can make a difference for you in your market. And you may have discovered through the course of the annual election period that there might be a carrier that you're missing. This gives you an opportunity to look through some of the programs that we offer in this space and see how we can help set you up with those programs, including connecting you to the carriers and any possible marketing support they may offer in addition to what Premier Marketing does. When you look at the PDP portfolio, you'll notice that it contains the listing of the national carriers as well. We have taken off the Envision Elixir program because that's no longer available to the broker channel, but you'll see that the national heavyweights are there for you for your use through our organization. This is a key portion of and means of recruiting people to your agency who may have a Medicare supplement, needs help with those PDP reviews, and that gives you an option to either update their Medicare supplement program or inform them of some of the advantages of a integrated program through Medicare Advantage. That Medicare supplement portfolio is very robust, and we do have different tools that we'll briefly discuss today that helps you be successful in that space as well. Those ancillary products in each of those categories that we mentioned, well, the national players are there for you. you'll see a spread of different eligibility or availability of these programs in different areas, because many of them may not have the same national reach as some of the large Medicare Advantage programs, but you have a selection to choose from, and the leaders in each of those areas are available to you as well. When we look at the Medicare market overall, this is important for us to take a glimpse at, because it's a burgeoning market, of course. You don't hear of anything else when you come on a webinar like today where someone speaks to the silver tsunami, the aging of the baby boomers, one every 10 seconds, 10,000 a day, that sort of thing. But if we look at it based just on age, we're missing a part of the market that really appeals to the Medicare Advantage space, because there are folks that come on Medicare and don't take advantage of all of their benefits initially. They defer, but there is a strong section, about a sixth to the seventh of the Medicare population. When you look at over 60 million people, that's quite a number, that are under the age of 65. And in most cases, the benefits that they can obtain through a Medicare supplement are very, very limited, whereas a Medicare Advantage program, well, it doesn't matter what age you are. If you meet the other qualifications for eligibility, that same package of benefits are available, and it's just a question then of locating this segment of the population to work with when you're dealing with Medicare Advantage plans. It's also a section of the Medicare world where they really need the help too. Being disabled earlier in life, or early in life, I should say, a number of them didn't have a chance to prepare financially, or if they did, through the course of battling the disability, they spent down monies. So these folks are also not only a candidate for Medicare Advantage plans, but they may also qualify for the specialized programs set up in the Medicare Advantage world, such as dual special needs plans, and it can be of great assistance to them. The Medicare population overall, of course, is very varied in the needs that they have. If we look at society in general, we are a bit of a melting pot, and Medicare world reflects that as well. You've got 2/3 of the population with 3+ chronic conditions. They need help with health insurance. They are also, in many circumstances, limited in their income and assets. This may qualify them for some additional assistance that are adjunct webinars that we do, such as helping with extra help, low income subsidy, and the Medicare savings plans. And we'll send a link to the last presentation we've done on that as part of the follow-up to today. But these are people then that can really benefit from pre-planning, in a manner of speaking, because they have a program that helps control their maximum out-of-pocket, which they don't have with traditional Medicare, and gives them the opportunity to plan for some of the other expenses based off of some of the maximum out-of-pocket limits on these plans. And it gives them then an opportunity to address health needs that are inevitable in each of our lives, and do so prudently. And it's a question of our having the knowledge to assist them in the area that can make us a success with that population, because they all have choices. To be honest, they don't have to do anything. They don't even have to take their Part B if they don't want to. The vast majority of people do, thankfully. In many circumstances, they'll add on a prescription drug program. We'll see a segment of the veteran population that don't even do that. They access their medications through the VA. We have different programs that help address marketing to veterans. They can, of course, choose a standardized, modernized Medicare Supplement program, a Medigap plan, and based in their area, they may have a number of different choices where the plan, the benefits are the same, the costs may be different, so we need to help them in that regard. But then there are folks that are looking at our topic today, and those are the Medicare Advantage plans, known as Part C, where they integrate all the benefits into a singular package. And we're going to go through that in some detail in just a moment. When people are initially eligible for Medicare, we see a fairly even split as to their choices that they make as to, do I go Medicare Advantage, do I go Med Sup? And a lot of that depends upon their health circumstances, their area, and other factors, network, some of those things. We also see a portion that are staying on original Medicare only. That may not be a total truism, because many of them may have benefits through retirement programs, or from where they worked, or through the Veterans Administration, or they may be a Medi in that circumstance, Medicare, Medicaid individual, or they may have nothing else at all. So in each of the areas, we want to make certain that we have the background and knowledge to help assist them. And so we send a link to this as well, and this is a basic acronym guide. I've been in the business since, well, longer than I care to admit, I guess, back when it was still Medicare Plus Choice Plans, before the Billery administration changed some of the funding, and we had a brief hiatus into active marketing of these programs. And I still have to look up things. That's the nice thing and the bad thing about our industry. It's always evolving, and making certain that we have a current guide to help us with some of these acronyms can help us not only in our understanding of what we are offering, but helpful also in delivering the message to the people we deal with. Because what we're doing is not only harvesting from our past efforts, we're planting seeds as we go. So as we pluck a flower, we plant another one. We cut a tree, we plant another one. And it maintains our marketing throughout the year based on some of the factors we need to come into play to help us plan for it. Because basically, what was 2020? Well, we're in the season of the Grinch, and it was a stink, stank, stunk in many circumstances. But it's amazing the number of people that, as an agent, were able to evolve and move into kind of a virtual presentation. A lot of electronic presentations and applications went in, more than we've ever seen, particularly when you deal with electronic scope of appointments and applications. And it is a period of adversity that we can learn from. And many folks already have. It's evolving, and that's part of what we'll talk on today as well. Because as we speak to Medicare Advantage, it's important that we give everyone the true picture, the good, the bad, and the ugly. To paraphrase to use a title of a Clint Eastwood film. And it's important that we do that in our analysis of the needs of the people that we're visiting with on an ongoing basis. And part of the advantages of the upcoming OEP is the fact that we can do certain movement for folks that have made a choice for Medicare Advantage plans. And we'll go through that in detail. So, to no longer belabor the point, let's talk about some of the specifics that we look at when we look to market Medicare Advantage plans throughout the year, not during just the open enrollment period of the annual election period, and how we can react now in the next enrollment period that we visit with. A basic background, however, on Medicare Advantage plans, they are, of course, a type of Medicare health plan that's offered by a private company that contracts with Medicare to provide A and B, and in many cases D benefits as well. These are companies that are vetted. They have to meet certain requirements in order to be able to offer these plans. That's why you don't see every insurance company doing so. And many of these programs then take advantage of the dollars that they're paid. They are paid per member per month based on certain factors: age, sex, health circumstances, the area in which they operate, and they are then the payer of the benefits that that individual is entitled to. So they process basically all the claims with some notable exceptions. Hospice care is still covered by traditional Medicare, even if someone is in a Medicare Advantage plan. That actually used to be one of the knockout questions a few years ago with MA plans. If someone was in hospice, they wouldn't be eligible for an MA plan, and that's changed. It is a program that comes with an offering based on different platforms: HMOs, PPOs, PFFS plans, or HMO POS plans, and those deal with the type of network that is associated with the plan that we're looking at. And so we have to make certain that we take into account a person's preference for different providers and what programs may be appropriate for them based on that analysis. And they may not all be available in a singular area. There are, of course, additional subsets of Medicare Advantage plans. These are the special needs plans in 3 different categories that are available to the public based on, okay, do you have a named chronic condition for a C-SNP plan? and there are a list of those illnesses that help a person qualify for it or are necessary to qualify for it. And it's a great area for us to prospect in specifically. We'll talk about that. There are also institutional SNP plans, and these are for folks that are living in an institution or require nursing home care at home. In many of these circumstances, the vast majority of this, they're generally not available for sale by the broker community. Those are normally handled by captive representatives, so it's something we don't concentrate on. But then there's also the dual SNP folks, the dual eligibles for folks that have both Medicare and Medicaid. When we looked at some of the financial background of a Medicare beneficiary, we see that many people will qualify for this assistance, or these types of programs, I should say, and that is something that is an area of emphasis for many people that continue to offer MA plans throughout the year. It is, of course, an entirely different demographic than we are used to in the insurance world because, well, a lot of the MA plans, we're not asking for a premium anyway, but these particular folks have bundled additional benefits that can still help them even if they're full Medi-Medi. And then there are also different types of Medicare Advantage plans that may not be as generally well known or as readily available, and these include MSA plans, Medicare Savings Account plans in the Medicare world. To qualify for an MA plan, of course, you got basically just two requirements now. The end-stage renal knockout question went away at the first of the year. That's integrated into the MA plans now. So regardless of health circumstances, a person can be eligible for these programs without a waiting period or a period where certain benefits aren't available to them. They have to have Medicare Part A and Part B to be eligible. So they got to maintain those coverages either through a continual deduction from their Social Security check or paying into the Medicare programs directly based on whether or not they're drawing Social Security yet. And then, of course, they've got to live in the service area in which the plan is available. If they move, then it's another change that comes about. But it's important to note then that you can't be too young or too old. As long as you're on Medicare, you can be eligible for the program. Personally, the youngest person I enrolled in an MA plan was 3 years old. Can't be too old. The oldest person I've enrolled was 102. So you can't out-age the plan like you can with some life insurance programs. If you get that magical triple-digit number, it changes the world of life insurance. So you've got those circumstances that make this a very simple plan where it's not underwritten. You just have to meet these conditions of living in the right area and having Part A and Part B. The standardized election periods, well, we just finished up with the annual election period. Many of you are probably catching your breath, but planning ardently for the coming year. And we actually have another webinar that speaks to being effective throughout the year in the space entirely. Today's topic deals just with Medicare Advantage plans. Then you have the period that we're in right now where a person can non-renew based on certain circumstances as well. And so that's important for us to note. We don't see a lot of movement in that area. And it is, however, one we need to watch, because if they don't do something in this category for certain members of the population, they lose their drug coverage. But we're about to engage in the open enrollment period with Medicare, and this is a unique period that gives an individual in an MA plan different choices that they can do, but it's one we can't actively market to. So that's kind of a misnomer for us, a little bit of a situation of, okay, how do we take advantage of this, or should we, or what's going on here? We'll spend a bit of time talking about that in detail. When you speak of the annual election period, that is the time between January 1st and March 31st of each year, where the Center for Medicare and Medicaid Services restored this benefit a couple of years ago now, will be a couple of years ago, to replace what had been the Medicare Advantage disenrollment period. If you went further back in the history of the offering of these plans, you'll see that the OEP existed before the change to that disenrollment period as well. So who can use the OEP? These are folks that are enrolled in an MA plan as of January 1st. So there are folks now that we're actively marketing to that are just coming eligible as well during the month of December. And these folks also have an OEP period throughout the year. People who age in after the end of this year, they have an OEP as they become eligible throughout the year as we speak too. So we have a circumstance that's repeated throughout the year, but the vast majority of people who are on Medicare, who are already in a Medicare Advantage plan, these are the folks that take advantage of this situation because they get a one-time election to make these changes. They can switch from a Medicare Advantage prescription drug plan to a different MAPD plan. They could switch from an MAPD to an MA-only plan, which may suit very limited circumstances. They can switch from an MA-only to an MAPD plan. It's the only way that they can pick up drug coverage during this period through the OEP. There are other SEPs that can become involved, but if you're looking at the OEP, that's the only situation where gaining drug coverage comes into play. They can switch from an MA-only plan to another MA-only plan based on benefits that may be a choice for them if they have medication coverage elsewhere. They can drop the MAPD plan and return to Medicare Advantage and do so and not pick up a drug plan, a standalone drug plan, or do so. That's up to them and to your sage advice. And then, of course, they can drop MA-only coverage and return to original Medicare with or without picking up a PDP program as well. There's different stipulations for the benefits, for the beneficiaries that are enrolled in original Medicare. If the enrollee has original Medicare, they cannot use the MA OEP to switch to an MA plan. So it's not a continuation of the annual election period. It is a period designed for folks that already have MA coverage. And it doesn't apply to those folks that have the MSA plans, such as LASSO, or a Medicare cost plan, which are kind of rare to have nowadays. That was a big topic of discussion a couple of years ago, how the discontinuation of many of the cost plans in many of the more urban areas brought about a decision folks had to make then too. And then, of course, Medicare supplements are also exempted. They're connected to original Medicare and MA program. The MA OEP has nothing to do with them. They have their own regulations we have to follow. We discussed that actually on Friday. And then, of course, there are enrollees of standalone Part D plans that cannot use the MA OEP to make changes to their drug coverage. So if they just have original Medicare and the standalone drug program, well, the OEP doesn't affect their ability to make changes either. So what can we do as active representatives of these programs through OEP? Well, CMS prohibits a lot of intentionally targeting or soliciting folks to join MA and Part D enrollees during this period. They have the regulations set where we cannot engage in activities that use MA OEP as an opportunity for additional sales. We cannot call or contact enrollees who made a new plan selection during the annual election period. We can't purchase mailing list or other identifiable information in an attempt to target this population using MA OEP. We can still mail for all the other SEPs that are out there, and we'll talk about that in a moment. And then, of course, we can't send unsolicited marketing material referencing the OEP or the opportunity to make an additional enrollment change. There are many of us that have seen a ton of commercials on TV of the folks that, man, back when MIPA was first instituted, we would have gotten fried for saying some of the things that are on TV. And quite frankly, now it does bring about a bit of confusion to the folks we talk to, and was a real talking topic for a lot of folks during AEP. But you'll notice those commercials have been tweaked now. Just saw one with Joe Theismann talking about as a spokesperson for a Medicare Supplement telehealth company that speaks to the marketing of Medicare supplements. So you see some tweaking there. You'll see some of the carrier advertisements place a greater emphasis on dual SNPs or on plan choices, those sorts of things. So a generalized approach that basically doesn't reference the MA-OEP period, but is as compliant as what they've done in the past, and it's part of the language that we look to emulate moving forward as we market, because there are certain things that we can do with the population, and that's continue to operate as we did before AEP, even in preparation for it. And by doing so, we're looking to accommodate requests for marketing materials when a beneficiary asks for them. We can, of course, set up that one-on-one meeting at the beneficiary's request where we can do a virtual meeting, a lot of Zoom activity going on. There are some folks that still insist in visiting face-to-face. We are an essential part of the economy, so we can do that legally. It's just making certain that we do so intelligently and take precautions to not become part of the population that is affected by this COVID-19. There are also, of course, a number of other special election periods that we can use, including marketing 5-star plans, because they have that continuous enrollment SEP. And then, of course, we can still market to that silver tsunami, aging of the baby boomers, one every 10 seconds, those agents who have not yet made an enrollment decision. You look at that SEP chart that's available to it, we can go through these lists and we can find a number of reasons to speak to the Medicare population all year long. Some of these you'll look at and you'll go, what the? Yeah, well, that's probably because you don't see them too often, but we, of course, have explanations for each of them. One of the pieces that we see most commonly is there are a portion of folks that become institutionalized, and an MA plan may not be in their best interest if they're in a nursing home that has a medical directive that's not part of the network that's associated with it. Plus, an I-SNP is nothing we can't market and get paid for anyway. So that's an area that may be more of a retention issue than it is for a sales opportunity. When you go further through that, you'll also find that many of these then deal with economic issues. Do we have the income and assets limits that can help us get that extra help, Medicaid or an MSP program? Once again, a different presentation, but this is a large portion of the population, and many of them don't have this assistance. Our being knowledgeable in that area can really help us with that circumstance. And then, of course, there are folks that, well, they lost some of that because their income changed favorably or for another reason or another, that we have to help them disengage from some of their current programs and into a regular MA plan, MAPD plan, or MedSup with a standalone Part D if it's in their best interest. And you have, of course, the movers. And these are the people that move from one service area to another, and that creates a special election period. You have some different people that may qualify for one of the SNPs that we talked about, and that may be in their best interest, and that is a common triggered SEP as well. You have some other folks that may have encountered different enrollment areas, not nearly as frequent, but these are pretty local folks, of course, and that is a standard SEP that is used. The people that are aging in are a big part of it. Some folks that, well, may have a 5-star plan still available to them. Those change year over year, and those have come out already, so we'll redo a 5-star presentation as well, specifically on that. There are still a number of MA plans that may be low performing. They have to be in that category for 3 years before they get kiboshed, so to speak. You see that more often in newer plans or in areas that are more of a rural offering, and those then give us an opportunity to re-examine and help them get in a plan that's better performing. So there are different SEPs that come into play, and then, of course, there is the special SEP across the country that deals with the challenges that Mother Nature have brought about for us. And so with that, we have a listing of this that will follow with the follow-up that gives you a complete listing by state of the different counties where this comes into play, when it starts being available and where it ends being available. So this will help people, particularly in the area along the coast that are affected by the hurricane activity, and in other circumstances, even in California with the wildfires and some of the things that come into play there. So this is a valid step that you can use during the prescribed time period for that particular area. That'll come to you. And one of the things that really makes a difference for us, well, this is an article from the Kaiser Family Foundation, link of which will come to you as part of the follow-up, that speaks to the majority of people not even comparing their coverage options annually. And as agents, we can see the changes that come about in these plans year over year, not only in the benefit package on the medical side, but the changes in the embedded drugs that are covered and how they're covered in these programs. So offering that particular analysis can be really helpful for you, and you'll find that you'll run across some folks that picked drug coverage on a standalone basis based on the price of the plan, not what the plan actually did, how it covers the medications, what medications are covered, then what tier. So having the wherewithal to make that analysis on an ongoing basis throughout the year, because needs may change as well, is important for us to keep in mind that this may be one of the valued questions that we ask. Did you do an analysis of your medications that are covered on your current plan during the annual election period? You may qualify for a special election period that allows you to change if another plan better suits your needs, and a great way of opening a conversation for all sorts of things. It's important, too, that we look at this piece of the population and realize that it's the majority of people that have done this, or I should say, hadn't done anything. Quote an old sales manager back in my Prue days in the mid-'80s, the decision to make a decision is a decision. They didn't do anything, they made a decision with it. So running across these folks can make a big difference. And to be honest, even if they have done that evaluation, this time of the year, sometimes they hit that deductible in the drug coverage if it's there. That may prompt them some changes. And you never know what tomorrow brings. There may be additional medications that come into play that weren't part of their life during the annual election period and merit that type of analysis as well, because there are also a portion of the Medicare population that don't have the means to make the comparison. And in many circumstances, they don't understand the Medicare program itself, and many of them don't even use the official information resources that are available on the Medicare Plan Finder. They don't access it. Either they're not comfortable with the technology or they don't have the technology to access it. And that's why we play such a huge role in what they do. That's because when someone gets on a Medicare Advantage plan, they don't give up Medicare. It's not a replacement. That used to be a big no-no to even say. You'll see some advertisements that do it now. I still would strongly recommend not saying a replacement, but this is an arrangement where the beneficiary is authorizing a private company to administer their Medicare benefits. They give up their Part B, they won't be eligible for it. So it's not a situation of them completely leaving the Medicare plan or the Medicare offerings. It's just how they are accessing those benefits, the common benefits in most circumstances, the medical portions for doctors and hospitals, and in most situations, the integration of the drug programs in it. These programs, of course, too, do offer additional benefits you don't see on traditional Medicare, and many times not offered with a Medicare supplement. And we're seeing a greater number of these programs offer additional types of ancillary benefits. You commonly see the vision, hearing, dental coverage. You'll see, many cases, transportation, or even a card they can use at certain retail outlets to access over-the-counter pieces. But we're seeing a lot of social determinant of health benefits come into play, certain SNP plans that may even offer coverage for air conditioning. So different things that come into play there that can be of great benefit for the people we're discussing. In many circumstances, too, this changes how a person is billed. If they get a bill and they're in a MA plan, they should call customer service right away and find out what's going on, because they shouldn't be receiving bills, plain and simple. Depending upon the platform of the network that's involved with the plan, they may need a referral to see a specialist. They may have coverage worldwide or across the country for emergency or non-urgent care. But these rules can change year to year, and what a person pays in a Medicare Advantage plan depends on different factors. Area they live in, is there a premium for the plan? What are their copays? What are their maximum out-of-pocket? It is, however, very convenient and a talking point on many of the commercials on television that it's an all-in-one plan. You have one card if you're accessing your benefits at the doctor, the hospital, the pharmacy, on some of the other ancillary benefits. It's also important to note that you can become disenrolled from these programs if you apply for a different MA plan. It does so automatically. Or some folks, in their confusion, may not realize that they have an MAPD plan and enroll in a standalone PDP program. It'll knock them out of the MA plan. So we need to be careful of what we're doing there as well. And keep in mind, Medigap plans don't work with Medicare Advantage programs. If someone has a Medigap plan, a Medicare Supplement plan, and they join an MAPD plan, they may want to drop their their Medigap policy. They're not required to. That's an important point. And they won't automatically be dropped from their Medigap policy by enrolling in an MAPD plan. The challenge is the Medigap policy doesn't cover any gaps in the MA plan. Doesn't work that way. Medigap plans file against original Medicare and not against an MA program. So if someone is in that situation, they want to make certain that they are enrolled properly in an MA plan and then look to decide, do I want to continue to pay a Medigap policy I cannot use, and how do I go about canceling it? So it's also interesting to know that if you're on an MA plan as a beneficiary, it's illegal for someone to sell them a Medigap policy unless they're switching back. So if someone goes into a household of an individual that has an MAPD plan and sells them a Medigap plan saying it's going to cover the gaps, well, it better be a hospital indemnity plan and not a standardized, modernized Med Sup. Otherwise, it's illegal to do so. So you also have some different things that you can go about doing to return to original Medicare if it's your first time in an MA plan. So it's that trial period that allows a person to go back and pick up the Medigap policy they were on if they do so in the first year. There is one Medicare supplement carrier that extends that to 2 years, but the standard rule is a year trial in an MA plan. If that company doesn't still offer the program, you have different opportunities to pick up different coverages, and some states will provide additional special rights in this area. This is a comparison piece from our friends at United Healthcare that goes through and examines some of the differences between a Medicare Supplement and a Medicare Advantage plan. There are folks in our community, in our agent community, that choose to offer one type of plan or the other. I have some folks that say, why would anybody join an MAPD plan when you have those network restrictions? And you have folks that are in the MA side that say, why would someone pay for a Medicare Supplement plan when we have MA programs that don't require additional premium? Getting away from that free word, no matter what Joe Namath says. So this is a nice way of making certain that we know what we're doing when we're offering the different types, even if we are specializing in one segment of the Medicare population versus the other. You'll see that the people that join MA plans have different statistical similarities. And in many circumstances, folks that work niche markets within the Medicare community, different ethnic groups, different religious groups, those sorts of folks, you'll see that many of them don't have the information available to them to make a viable decision. And we'll see that if you are of a particular ethnic background or if you speak the language, it can be very helpful in working with this population. We also see in many times the Medicare Advantage plans will work to accommodate information requests by making them available in different languages. Sometimes that information isn't available right at the first of the year, and we have to be careful about how we translate things and the material that we use. So what we see is a burgeoning market. It's an increasing market, and some people right now may be having that buyer's remorse as to the choice that they made. When they get to the first of the year, we have the OEP that can be valuable for them in switching, even though we're not marketing it specifically. We're using it as a reason for change. We have all those different steps out there that can happen. And it reminds me of the old Monty Python movie where they're hauling out the cart and the guy's banging on the bell saying, "Bring out your dead." There were a time period in the not so distant past that we thought Medicare Advantage, boy, it's facing some challenges. But it is strongly rooted within the choices available to the population and is an ever increasing share of how people access it. We'll see that people of certain income, age, and gender will be more likely to pick up an MA plan than some of the others. So this helps us in our marketing choices in many circumstances as to who we're appealing to, who we're mailing to, who we're reaching out to through different social media outlets, or however we are procuring our prospect population. We point it in certain areas. It can be helpful because they're more likely to pick up this coverage. You'll see, too, that, well, the big get bigger in many circumstances, but we see also a proliferation of many of the regional programs. The market is dominated basically by these carriers, as you can see. United Healthcare didn't offer as many plans as Humana did this past open enrollment period into 2021. They still have a larger portion of the market, but you see those two big beasts doing it, with Aetna coming into play, and Blue Cross and Blue Shield Anthem, a major player in different markets. Different with them because the first two, it's a national contract. You pick up a Humana or a United Healthcare contract, it's available in all 50 states. The offerings may be different and are, but you'll see that Aetna and Anthem aren't available in all states, and that is a factor we have to take into account, obviously, but it also gives us an opportunity to look at the areas where they are and how they are a major player or not, based on circumstances. And then, of course, Cigna is more regional, even though it's a national name, not available in all 50. They have a lot of great benefits available to them. The Kaiser plans are not available to the broker population, so that kind of eliminates that. Centene has a number of different companies underneath it now. They've been in an acquisition mode. We see them in certain areas with different names associated with them. A lot of times people will look at Centene and go, "Hey, that's the largest insurer of the population that's in prisons," believe it or not. So different things that come into play. It's just a burgeoning market. A lot of people are growing. Our knowledge of special needs plans can really help us because this is a growing market as well, not as deeply penetrated as the general Medicare population. So those folks that work with the dualies, the dual beneficiaries, Medicare and Medicaid, that niche market can really help them in this space. It's many agents will look at that and say, "I'll accommodate it as I run across it. I'm not going to specialize in it. Don't want to lose a sale." But they may point to a population that have other discretionary funds that could result more likely in a cross sale. The government's going to help you with information about these choices. They do some wonderful things on YouTube. This is a live video that is on it that is about 4 minutes long, and it helps the general population understand Medicare choices. Many of them don't access it, but we can make it available. And then, of course, we have the plan finder that can help people. We've already talked about how a good portion of the population don't even use this tool. And They may have access to it and know how to, but they've chosen not to examine things year over year, the majority that we talked about. Some folks don't have the expertise, even if they have devices to access it, to use it properly. So we have different tools that can come about through our organization where we can lay out those carrier benefits for you and help those folks with choices. There is a growing number of people as they age into Medicare or have become more comfortable with these devices, where it is an increasing number of these folks that can access some things electronically. That's critical for us now during this time period because we're doing some things virtually. Are we doing Zoom meetings? Are we Skyping? Whatever it takes. Because a lot of these folks that are grandparents, they're doing that with their grandchildren. There is a certain amount of proficiency, and we need to tack on to that simply because we need those tools to get that electronic scope of appointment to discuss these benefits compliantly. We need that email address to send links or texts or however we're doing this to satisfy not only the compliance issues, but the enrollment possibilities as well. And people are getting better at doing that. So we have to be able to haul out the old line from the Friends TV series, pivot. Are we doing it virtually or are we doing it in person? And that can also be a big part of our marketing program because, well, we can set up something and plan to do it face-to-face, or we can set up something and plan to do it virtually. But in many cases, in many circumstances, the people we're dealing with are facing the same problem we are. We're dealing with churches or other centers of influence, a population of a doctor's patient base. These people, particularly the doctors' pieces, are accustomed to a telehealth visit now, and they are much more open to that virtual presentation. We just have to make certain that we're good at it. We have the technology to accommodate that so we can pivot from an in-person to a virtual situation, and the different carriers make the presentation simple for us. We do so. Here's a video that Humana provides as part of their HMO presentation. Same sort of circumstances is available from Aetna. And United Healthcare does some of the nicest things as well. And then, of course, we have our Medicare Center that we offer our agents at no cost, that they can access 2 different MAPDP quoting engines powered by Connecture and Sunfire, and the CSG Medicare Supplement quote engine that's part of it as well. It has a CRM that you can utilize and make use of to help track the business, and gives you the opportunity to obtain those electronic scopes compliantly through different means, email, text, different places like that, and store them for that 10-year period that's required of us if we sell them or not. It's a universal login and can be really, really helpful for you because you can send out comparisons. It creates a microsite for you where you can drive people for them to enroll on their own. And we're seeing an increasing amount of folks that are shopping before they talk to anybody. And then, of course, what do we get for helping these people? Well, it varies according to the area and can be different in different circumstances. And pardon me, because I replaced this with a 2021 piece and it didn't stick, obviously. So we've got an increasing commission level across the country, and it depends on if it's the first year in a program like this or if they are on a renewal basis. And it's important for us to note that one size doesn't fit all. That goes beyond the choice between Medicare Advantage and Medicare Supplement plans. The difference is in some of the Medicare Advantage plans within an area fulfill that same question as well, because some of the benefits may be pointed to a certain portion of the population, and we have to be aware of that. Plus, of course, the cost considerations that come into play. When we look at MedSups, there are a number of things they don't cover. We've actually got a presentation on that, what Medicare doesn't cover and what we need to do to help them in that circumstance. That link will come as part of the follow-up too. But it gives us an opportunity to speak to other needs within that individual's household. It may require a second appointment, a 48-hour cooling off period if we're talking about non-health situations, but if you're looking at long-term or short-term care, you're going to want to prepare anyway, setting up on a different appointment to go to address that issue. Well, that makes good common sense because you come prepared. It also gives you an opportunity to look at life insurance, final expense, and you can add on these ancillary benefits during that same appointment because they're health-based. And you'll see that even if those are offered within a Medicare Supplement program, they're just discounts for the most part. And in certain circumstances, even on an MA plan, they may not have enough coverage through the benefits that are provided there. So how do we get in front of folks? Same things we've always been doing. If you cold call for Med Subs, hey, you can still do that. Can't cold call for MA or PDP plans, but you can do that for a Medicare Supplement review, which that CSG tool is great for you to do. You can still access those centers of influence in the community. If you worked retail, you still have an opportunity to do so through OEP with Walmart. Any of the carriers will still support you during this time period or year-round in a retail setting. Faith-based organizations, they need our help too. You know, we could protest, but we couldn't go to church in many circumstances. Don't mean to get political, but that's a reality for our faith-based communities. And having that information available to them through their church can really help you reach a portion of the population that doesn't respond to other marketing activity. It also gives us an opportunity to help out those churches. Some of them are doing virtual services. If they have that capability, that's the same capability we can leverage to offer them information on different programs. We've got a number of them that are available as well. Carriers will support you throughout the year. In many circumstances, they may even have co-op money available even now. So if you are working heavily with one carrier or another, it's important that we visit with you through our marketing representatives, our agent success managers, to see if different programs offer you that support moving forward and how we can access it. There are the different community activities, which are much more limited now. Health fairs used to be a really big thing in life. Well, in an area now where that's kind of shut down, that may be handled virtually as well. You do still have an opportunity to door knock. Many agents still do that for Med Sup or final expense. Social media is huge. A lot of people using Facebook type of accounts and that sort of thing. And we do still offer direct mail support, utilizing some of the different tools that come into play. You can maximize the value of all those prospecting methods by going through and being prepped or being prepared to offer an analysis on their supplement programs or a cross-sell based on some of the coverages they have now and they like and they don't want to change. You can do some things to fill the holes within them. These programs, each of them offer that e-scope where it's available for you to obtain it electronically and store it for that time period that is prescribed by the government, that 10-year period if we sell them or not. And the e-applications are wonderful. Within Medicare Center, you have the opportunity to do so where you can just direct them to your microsite. They enroll there, you get credit for it. You can walk them through different enrollment processes and make it very simple. You also have that same sort of technology available through different carriers. And in many circumstances, you can access it directly in a Med Sup world through a CSG component that's in our Medicare Center as well. That cross-selling thing, that's a huge point because, simply put, that may be one of the reasons for a touch point moving forward with the population we already have enrolled. Gives us an opportunity for other sales, and it gives us the way of making certain that we're maximizing our time and our opportunity and doing so in a manner that keeps us out of hot water. There are different compliance pieces that are built into these systems so you follow the steps. And then, of course, the application process. If you're not using an e-app, please start doing so. You will see an increasing number of people that are much more effective in using that. It really helps the application process. You can't submit something that's incomplete, or more importantly, in many circumstances, it translates our handwriting into the electronic form. At one point in time, when I was the regional for the SNP programs for United Healthcare, at one point in time, over 80% of the applications we collected were pended because processing had a challenge with our handwriting. Electronic circumstances take that out of play. It makes the application go through much more quickly and cleanly. It gives the person the notification that they've enrolled in a program more quickly, which helps with your persistency and retention. And it also gives us a means in many circumstances to take advantage of the health risk assessment that many of these companies are paying us for that additional 10 to 15 minutes of work. And they require that be done through their e-app in order to do it. So at that point in time, after you've done the comparison in Medicare Center, we want to use Lean or Ascend or whatever electronic tool the carrier is using to accommodate that HSA. But it also gives us then that importance of being paid more quickly through the regular year. Because keep in mind, during AEP, that's the only period of time where you're not paid almost immediately on an MA plan. You got to wait until after the first of the year. That HSA is paid more quickly, but the government dictates when a carrier can pay, and as we saw in a previous erroneous slide, how much. So some of the things that we're going to do to help, if you're looking at different programs and you discover in the MA world through your personal experience in your market, be it that regular geographic area that you traditionally work, or if you've branched out larger because you've gone virtual, this gives you a way of creating a agent profile, storing all your information on there, and picking up additional companies electronically and simply. And that's a great way to use some things if you've got MA contracts in an area, but you're looking for a health or a HIP program, a hospital indemnity program, or a dental vision hearing program. Accessing the electronic version of that, that's one click on a company, and you can get that contracting done much more quickly. We also want to make certain that we're covering you for errors and omissions. It's not a blanket policy. It's a program you own that covers you regardless of who your upline is for whatever product you're offering in the insurance world. A great piece that allows you to protect yourself. So it's not like being added to a blanket policy for one company and then you got to worry about the rest of the folks you deal with. It's going to cover you regardless. We also help you with your licensure, where our association with WebCE gives you an opportunity to make certain that you have the continuing education you need to be covered in those circumstances. We also offer you an opportunity to add to your own benefit package with an individual non-cancelable DI program that is available to you on a modified guarantee issue basis, where you share in the commissions at discounted rates, and it can be really helpful for your own situation. Much as where today's presentation is being recorded, we have a library of past presentations that you can access 24/7 and utilize the pieces of information there to help you on an ongoing basis according to your own schedule. And a link to that will come in the follow-up as well. And then, since in many circumstances these companies will offer different incentives for you in the insurance space, normally that's not part of the MA or PDP world because that comp is governed by the government where the max is set, and it wouldn't help you with qualifications for different trips and incentives. That's not the case in the Medicare supplement world or with some of the ancillary products. So that will give you an opportunity to gain all this information so you're knowing that you're getting paid everything you are entitled to. We have it on a certain part of our website, and they will also qualify you for our marketing incentives, which has changed from trips because of the uncertainty that's involved there to additional cash based on your qualifications. So giving you some additional lead sources with contact lists available for you, butted up against do not call, a discounted rate, or in many circumstances gratis. And then, of course, going through those different centers of influence in the community, different programs set up as to how you can maximize that opportunity. Separate webinars in each of those circumstances give you helpful tips to become more effective in there. We've talked about the fact that carriers will help periodically. There are internet leads available, and we do so offer that Medicare, the direct mail support. That custom list is available to you. You have the opportunity to visit about maximizing your retail. We've actually got a webinar coming up in January for those that have participated in the past to see how they can leverage that moving forward. We have, of course, the faith-based opportunities that we discussed in a little detail before. These folks really need our help. And our expertise in reaching out to the population virtually through our experience through this past AEP can really help these folks maintain contact with their congregation. If they're already setting up virtual services, it's a way for us to offer topics of value utilizing their technology as well. And those different topics that are available, there's a ton of them, but we've got certain ones that are already set up and vetted for you. You can pop in your personal information and run with them. A ton of Medicare 101 information on a generic basis through the government or through different carriers that are available, and explanation of the different options within the Medicare arena. The MA, Medigap, Part D programs, a nice piece on the low-income subsidy Medicare savings plans, that financial assistance programs for drugs and Medicare costs. There are programs out there to help you with Social Security programs. Legacy Safeguard is a great pre-planning tool that helps with final expense sales. Information on charitable bequests that are really helpful for nonprofits or faith-based organizations, and then some legal presentations as well. Working with providers, man, they need our help. And this goes beyond just doctors or specialists. Sometimes that is the population that is delivering the services across the board in the Medicare community. And then, of course, there are a portion of the providers that aren't part of a network that need our help as well to speak to programs that they do participate with or entertain. And this is an area that isn't as heavily marketed as some of the others. I mentioned you can get some carrier support throughout the year. A lot of this is based on a symbiotic relationship. I apologize. I noticed I'm going a little long. I'm going to speed up. We're almost done. But this is an opportunity to leverage the relationships that we've made and utilize the contacts many of these carriers have in their space with feet on the street. So our agent managers within these different carriers are invaluable for us. They have been through AEP. Moving forward through the rest of the year, these are an important point of contact for us. We may have national co-op dollars available that we can discuss, but there may be regional assistance programs available for you as well. That's why having that relationship with your favorite carriers, agent managers, is really important for you. We do offer still the direct mail support based on productivity, on some of what things that you've done, but it deeply discounts the cost of a mailer based on the number of applications per month. And there is a program for this for the Medicare and health coverage portion of our business. And there's another one for final expense as well. So you could technically qualify for 2 different mail programs through our organization. We have preferred vendors that we use because we work with them hand in hand to make certain that the letters are vetted by the carrier, and we are following up with our due diligence when it comes to compliance as well. We have different fresh leads available that are based off a mailer campaign where you're not setting up the whole mailer, waiting for it to come into play and then getting the returns and utilizing the CRMs of the different vendors. But these are returns that have already come in. You're paying on a per piece basis here, a couple of different ways of accessing them, and the prices vary. And sometimes they vary according to, particularly with the YEG group, what's in the inventory at that particular point in time. T65s and MedSups are common returns that they have available through this organization. And then, of course, we have Facebook leads available for final expense and Medicare as well, generally Medicare supplements. This gives us a way of utilizing social media, particularly Facebook, which is more commonly used by the demographic that we appeal to. All that said and done, what we're looking to do is help you with your Medicare Advantage business throughout the year. And a generalized presentation like today applies overall, but there may be certain niceties that we have to make certain that we abide by or give us additional opportunities in a particular area. And so that's where if you've determined to make certain that this is a part of your year-round basis, that we speak to you about those opportunities that we've identified in certain markets and the means that we have available through our own resources or through our affiliation with the different Medicare Advantage or PDP carriers, how we can make that a part of your overall marketing plan. That's that presentation on the 29th on planning beyond AEP that we have, that we'll talk to and speak to that in greater depth. That conversation, well, that can be a portion of our outreach and follow up to the email we send out as follow up to today's presentation, but you can reach us as well through our toll-free number at 1-800-365-8208 or visit our website at premiersmi.com to initiate that conversation as well. What we're looking for here is now looking at some questions. Bear with me a moment. Someone had some audio difficulty. I apologize. I only see that once, so maybe that's just a challenge with that particular individual. We will be sending out the recording as well, and you'll have audio there. Do we have a generic electronic scope of appointment that we can email prospects? Yes, we do, and that is available through our Medicare Center as well. I do have a PDF of a generic piece that I'll send out as a part of it as the follow-up. Does the 1-year right of return to MedSup from MAPD allow you to return to any MedSup carrier, or are you limited to returning to the carrier you had prior to joining MAPD? Well, that all depends on if you want the guarantee issue to go back into play. The person has health circumstances, they have to go back to the carrier that they had a program with, or the one carrier that will accept anybody for that 2-year period. If a person joined right away, it gives them an opportunity for a wider choice right away when they first became eligible, a wider choice of different possibilities there. Let's see here. I've got some others. Oh, must have answered the question through the course of it. I apologize for those that have had some audio difficulties, but we will send out the presentation with that attached. I'm not certain why that's affecting just a certain number of people. But all that said and done, we realize that right now, most of you are kind of catching your breath. Your time is so valuable, and we appreciate the investment of that time with us here today. We look to make certain that you get value out of today's presentation and help in your planning process moving forward with different choices in the MA world. That's a discussion we'll have with you on an ongoing basis because some things change throughout the year as well. But until then, we want to wish you a great selling season in 2021, the whole year as a season. We want to thank you for the business that you've done with us, sincerely. You are the engine that drives this effort, and we realize that and want to make certain that we have all this available to you with maximum support. And until we have additional conversations, we wish you good selling. Thanks so much for coming aboard and listening today, and we'll talk to you soon. Happy selling.